Hi, I'm Greg Fell, I'm Director of Public Health. This is a situation report of today, 7th of April. So R is still below 1, just 0.8 to 1 for Yorkshire and the North East. As I say, we don't have city level estimates. Overall, the rate is settling to going down again, just below 100 per 100,000, and that's a significant fall from a couple of weeks ago. The over 17 rate and the 18 to 34-year-old rate was increasing now and settling, and is also now beginning to go down. And really importantly, the over 60s rate continues to fall and fall and fall and fall. So that's clearly good news. There's a really important issue, I've mentioned it before, I'll mention it again, on rate per 100,000 versus impact. Rates are higher than any of us want. They're beginning to come down again, that's good. The over 60s rate is going down. That's undoubtedly the impact of the vaccination programme. There are some tricky issues around the rate in the 40s to 60 age group. They're not as well vaccinated, so when you are invited for vaccination, it's really important that you attend. Hospitalisations are continuing to go down, and they continue to go down. Pillar 1 positivity, which is a really good indicator of how much true illness there is there, that's the tests of people who are hospitalised, is low and constant. All up, I'm happy that we're on track for the government's 4 tests in the roadmap. The vaccine deployment continues very successfully. There's very clear evidence that vaccines are reducing hospitalisations and deaths, no doubt there. Infection rates don't look to be set to surge anytime in the near future, and clearly that would have an impact on hospitalisations if they did. They're all going in the right way at the moment. It's important that we keep to the advice. And there's no fundamental risk assessment that's changed with regard to variants of concern, though that may change. We don't know when that will be. But all up, variants of concern are pretty low. So things are looking like they're going in the right direction. I remain happy that the government's 4 tests are met. Vaccination programme is going very well. Alone by itself is not good enough, or not by itself enough, doesn't work in 100% of people. But all up, we are on track, but it's important that we stick with the advice and we don't go mad. On vaccinations, we are very definitely prioritising giving more people their first dose to get the maximum benefit for the most people in the shortest possible time, and then giving second dose within 12 weeks. And that's a strategy that will help save as many lives as possible. That's the point of the vaccination programme. People who received their COVID vaccine in December 2020 are now being invited to receive their second vaccination. People's second dose will be the same vaccine as their first dose, i.e. if you had AstraZeneca first time round, that's what you'll receive second time round. And you'll be vaccinated at the same location. So people who got their vaccine at the local vaccination centre in Sheffield will be contacted by their GP to arrange a second dose when it's their turn, and at about 11 weeks. Please don't contact your practice, they will contact you, but it could be short notice. Those that were booked through the National Booking Service will have their appointment booked for their first and second appointments at the same time, and thus you won't be contacted by your GP. Full protection kicks in about a week or 2 after the second dose, which is why it's important that when you do get invited, you go at the earliest possible opportunity. Being vaccinated doesn't protect you 100%, but it definitively remains our best defence in our fight against the pandemic. And even those that have received both doses of the vaccine will need to follow social distancing and other advice that's out there. Ramadan is coming, so I'd like to take this opportunity to remind Muslims fasting during Ramadan that the British Islamic Medical Association and local doctors have reviewed the teachings of Islamic scholars and confirmed that having the COVID-19 vaccine does not invalidate the fast. So if you are contacted for either your first or your second dose of the vaccine during the holy month of Ramadan, please do not delay and take up that opportunity immediately.